welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I have a very interesting discussion for all of you. I will be talking about anabolic steroids. So, what are these anabolic steroids? Now, they are synthetic methods that actually mimicked the effect of the male sex hormone, that is testosterone, and they are primarily used to improve athletic performance and even muscle growth, mostly which acts as a game changer you need to elevate your fitness journey. But all these come with many health problems as well. So to discuss in detail about this, we have with us today Dr. Sanjay Prakash J, who's a consultant urologist and microsurgical andrologist in Chennai. His area of expertise lies in erectile dysfunction, male infertility and male sexual health, microscopic varicocele repair, penile implant surgery. He is well trained in endo-urology procedures and laparoscopic surgeries, trained in basic robotic surgeries as well. Welcome to Medical Dialogue, sir. We are really happy to have you on board here with us today.
Hi, thank you. It's my pleasure. Yeah.
So, sir, now that we're talking about anabolic steroids today, that is our topic of discussion. What are anabolic steroids and how do you think they differ from other types of steroids?
As you already gave a brief introduction, so that's what steroids. You see, steroids are basically those hormones and substances which are produced in the body naturally. They come from the adrenal gland. So the steroids are responsible for multiple purposes. Like, for example, the overall body's growth, development, then the energy metabolism, bone health, maintenance of the heart function, kidney function, etc. So these are the natural ways what it happens. And in addition, there is something group of steroids which are known as the anabolic steroids. Anabolic steroids naturally in the body comes from the testosterone. So basically these are testosterone derivatives. So steroids are also being produced pharmacologically. Pharmacologically, its main role is kind of immunosuppressant roles. So it's being used in multiple conditions like arthritis, or patient have severe allergy, bronchial asthma, such conditions. But as such, these testosterone derivatives are also being produced pharmacologically with the purpose. So there are some certain indications medically, but unfortunately, although it's okay to use these in moderate amounts, it's being abused.
Great, sir. So now that we're talking about this in a little bit of detail, what are the primary medical uses for anabolic steroids, and how do you think they are prescribed in those cases?
That's right. Medical use as such is that anabolic steroids has a very specific group of indications. Firstly, it is used in conditions something known as a hypogonadism. What is hypogonadism? That is, by birth itself, some children, adolescents, in them the testosterone levels will be naturally low. So that will interfere with the subsequent development in them. So in such cases, they will be requiring external administration of testosterone so that their overall development improves. And also in cases like delayed puberty, and also in the adults, you see, just like there is a concept called menopause in female, there is a andropause in male as well. Andropause means in the elderly males, the natural testosterone level falls down. Testosterone is not only important for the sexual function or the infertility, but the overall health, the bone health, the mental health, the heart, and then the maintenance of the sugars, obesity, all these. So there is a depletion in the elderly, what we call as andropause. So there it is indicated. So these are all collectively known as hypogonadism. And in addition to this, in certain breast cancers, and then in severe refractory anemia. Refractory anemia means which do not respond to any other forms of treatment, and muscle wasting conditions like patients on chronic dialysis, the CKD patient, there's a chronic disease, kidney disease patients, and also like HIV patients where there's a lot of muscle wasting, and also the patients who are on cancer chemotherapy. So in such conditions, these anabolic steroids will be very helpful. As a term, anabolic means making, building. It helps in increase protein protein synthesis in the body, and subsequently builds up the muscle, not only the muscle but also the bone strength as well. So it is also used in conditions of severe osteoporosis. Osteoporosis, as you know, it's the extreme bone weakness.
All right, great. That was a good, concise you've given us on the uses of anabolic steroids. So, what are the most common reasons people misuse these anabolic steroids, mostly outside of medical supervision, if we talk about it?
Okay, so the why the anabolic steroids are used is that, okay, it's because of the instant effect what it produces. So it increases the muscle bulk, it also increases the bone strength. So on the whole, a person's person's energy also increases. And of late, these anabolic steroids are also being used as a part of the weight reduction supplements, because they tend to reduce the body fat content and body water content, and subsequently and also increase the protein levels. And these are also being used to improve the mood. It was initially used in the segment, okay, that is the extreme athletes, the professional bodybuilders, weightlifters. So these were the people who were using it. But now, since this increased, so-called nowadays, with the increased tendency of people becoming the so-called fitness freaks, so people have started. They want to come into shape, so they've also started using it. And also these called recreational users, they've also started using it. So this is where the abuse goes away. That's what.
Great. Definitely, sir. The potential weightlifters and bodybuilders, they are the ones who need to enhance their fitness journey, and they have to broadcast it in the long run. So they are the ones who actually are using it and rather misusing it, if we talk about it. What according to you are the short-term effects and the potential benefits also of using anabolic steroids? If I talk about with respect to male infertility.
Okay, obviously, okay, there are some benefits. The benefits, as I already mentioned before, the overall body strength for an athlete, okay, why they take is that the overall performance it improves. It's basically considered like a shortcut to success. The overall muscle strength increases, the muscle mass increases, the bone strength increases, and also they don't get tired that easily. So they tend to work out for long hours, and they tend to be charged for a long time. So these are the main reasons why it's being used. But unfortunately, like a shortcut to success. Okay, they want a success in a shorter duration. So people are tending to misuse it. And and my field of interest, with respect to infertility, yes. So we see a lot of patients who are actually who are using these drugs and come to us with different stages of infertility. That is, it basically interferes with the overall production of sperms and the quality of sperms. It's not only about the quantity of sperms. It doesn't matter like how many million sperms you have. The quality of sperms is that is very important here.
Okay, so now, sir, that we're talking about the potential effects as well as the benefits of these anabolic steroids. So, do you think these changes are irreversible?
Yeah, actually, it depends upon the duration of the steroid being used, and then what type of drugs are being used. Because there are different types of drugs with different potency levels. So just to keep it simple, so it all depends upon that. So even if a person completely stops all these drugs, so the amount of recovery, that is amount of recovery of the sperm production, so it is actually variable. A person may completely recover, or there will be some amount of partial recovery, or the patient's recovery may not happen at all. So this purely depends on what type of drug is being used, and also what is the duration of use.
Okay, so now that we've talked about the effects, these changes, whether they are irreversible or not, so what do you think, what are the effects that these will cause? What are the changes that they will bring either into our hormonal levels as well as even the organ systems?
Overall effects first. So you've seen a lot of people who actually use excessive amount of these anabolic steroids, that they'll have male pattern baldness. So in addition to that, they'll have a lot of acne coming out very soon, not only on the face, the chest, the shoulders, these areas. And in addition, considering the mind-wise, mentally, so they tend to be little bit aggressive on the whole. Aggression seen in every aspect of life, and they also tend to become sexually aggressive, and they tend to go to a stage of mania and psychosis. Nextly, okay, it affects your heart, it increases your BP, it causes cardiomyopathy, it increases the viscosity of blood, that is the fluidity of blood, so that it may lead to heart attacks, even stroke. It can affect your kidney, it can affect the liver, doesn't spare any organ. In the males, the prostate becomes enlarged, and subsequently also urine issues develop, and the chance of developing prostate cancer as well. In the women, if you see, women, they tend to become more manly. That is, they develop a lot of body hair, the voice deepens, they also have menstrual irregularities as well, so leading to some infertility issues in them as well.
Okay, so that was a well concised version of the effects that it causes on each body system. So definitely, we are supposed to look out for the anabolic steroid misuse specifically. So are there any safer alternatives for individuals who actually wish to enhance their athletic performance or build muscle mass without actually using anabolic steroids? Is there any way around it?
Yeah, anabolic steroids, and according to me, in moderation and under supervision of a health expert, is always safer. So that is what the first thing. People have to understand that there is no shortcut to success. That is the most important part. Obviously, a high protein diet. They have to consult a proper nutrition and a high protein diet, so that will be helpful. And also certain type of fitness programs. For example, okay, people will concentrate on the triceps, biceps, and the quads on a particular day. So similarly, like that, they'll have to concentrate equally for all that, and then maintaining a perfect regime, a diet and a fixed regime. And obviously, anabolic steroids, it doesn't need to be avoided completely. It can be taken in a moderate amount, but under supervision. Underline that. That is the most important part. Do not self-take it at any point.
That's a good takeaway message given out, sir. Definitely, it has to be done. Usage has to be over under supervision. So, any message, how can healthcare professionals help individuals who are struggling with anabolic steroid abuse or even addiction? Is there any takeaway message that you would give out to our healthcare professionals?
Okay, yeah. As a andrologist, okay. Firstly, I would like to tell, okay, these kind of people, okay, visit a doctor primarily for two reasons. One is that, okay, they'll be married, okay, they will not be able to have a child. First. Second is that, okay, they'll not be having a good quality erection. So these are the two early and common reasons, okay, why they come to medical attention. So that's what. So as I would like to advise such individuals that before you start these kind of any regimes, have a baseline health evaluation and also have a baseline fertility potential, because we really don't know, okay, what is your baseline itself. So subsequent, only if we know your baseline, then we know what is the effect that these drugs have caused on you, and to what extent, okay, we be able to reverse it. And always when you go for medical attention or you're on a fitness program, always consult a physician who's an expert in this field. So that is what. So that is most important, because they won't just see you with respect to your fitness, your muscles or your overall performance. They will see you comprehensively. So when these drugs are being given, you need to be monitored comprehensively. Your whole body is important. So that is the important point which you people have to keep it in mind.
Great. That was a wonderful takeaway message given out, sir. Definitely, it's something which has to be taken under supervision, and healthcare professionals can easily diagnose even an anabolic steroid misuse or an abuse or even an addiction. So thank you so much for giving us a concise and a crisp version of anabolic steroid use and its potential effects as well as its harmful effects. Thank you so much for all your valuable insights. It was lovely to be interacting with you today, Dr. Sanjay.
Yeah. Thank you very much.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.